unrealistic request. John Ironmonger reports.
The Thistlemoor Medical Centre used to get hundreds of walk-ins every day until the pandemic put paid to long queues and packed waiting rooms. But what now, as restrictions are to be lifted entirely?
I think for general practice, there's a new normal, and it's the way we're working at the moment.
That is to say, more telephone triage and face-to-face appointments on an ad hoc basis.
It's just regarding your blood test. I think in primary care, the staff will still be wearing masks and will still be asking patients to choose to wear a mask.
Matt chose not. He's full of praise for the practice, but is done with restrictions.
We are tired of this, but I prefer be without mask, to be honest.
What do you think about phone appointments or online appointments instead of coming in?
I prefer face-to-face.
Matt has varicose veins and has been asked to come in, though reduced in-person appointments are more common now than, say, a year ago. But for some patients in central Peterborough, there was an expectation the changes would come quicker.
So most of them come without their masks completely, and then they are asked to be put on. They ask for face-to-face straight away because they feel like they should have the face-to-face.
And that's a new thing, is it?
So it still has been going on when the restrictions were here, but it's been more now than before.
Yeah, it's like, it's all over, they expect the old service to resume.
Yeah.
Demand on this practice has increased by about 25% in the past 2 years, in part due to longer waits for hospital appointments.
Yeah, I think it would have changed without the pandemic anyway, but with the shortage of staff, the changes that we've made actually have made it a lot easier to be able to deal with the workload that we currently have.
Christiana has been asked to come in for a face-to-face appointment after suffering with back pain for 3 weeks.
I've had 4 over the phone and it's not helped, so...
And so you weren't particularly happy
No.
or reassured by them? No. And why was that?
Because you can't really tell over the phone what's wrong with my back.
So what about Christiana? Should patients like her be getting seen sooner?
I think as a population, we want the best for ourselves, and that's really understandable. We all feel like that. But it's trying to think about the greater good as well.
As we enter this new post-pandemic world, it's becoming clearer that nothing will be the same again. John Ironmonger, BBC Look East.